Welcome to this brief overview of quality management in public health. In the next few minutes, we will cover what quality management is, how quality management differs from quality assurance, how quality management fits together with performance management. We'll list the principles of quality management and briefly focus on each principle. We'll look at common steps in implementing a quality management system, important considerations for success, and we'll see an example from the field of public health. Then we'll have a quick quiz and end with a list of additional resources. First, let's start with a common definition of quality management. It is the act of overseeing all activities and tasks needed to maintain a desired level of excellence. This includes creating and implementing quality planning and assurance, as well as quality control and quality improvement. It is also referred to as total quality management, or TQM. This generic definition is from an online resource, Investopedia. Quality management focuses on work processes. It is about the level of excellence you strive for within your organization. Here is an important note. Quality assurance and quality management are not the same thing. Quality assurance can be a component of an overall quality management strategy, but there are important differences. Quality assurance is more about identifying and working on problems after they occur, and is thus reactive. A quality management approach is proactive, seeking to prevent problems from occurring to begin with. Quality assurance may be driven by regulation or contractual requirements. In quality management, the primary aim is to meet customer demands. Quality assurance can be considered management by status reporting or crisis response or putting out fires. Examples of quality assurance in public health could include HIV case chart audits or auditing infant-toddler network cases to ensure clients truly meet eligibility requirements. Quality management is driven by culture. Such a culture is visibly promoted by management, with quality improvement efforts frequently initiated and led by staff. A final key aspect of a true quality culture is one where staff consistently seek to exceed customer expectations versus simply meeting minimum requirements. Here is another important note. Performance management and quality management fit together, but are different. Quality management is a component of an overall performance management system. Performance management has a focus on measuring and improving both programs and processes, while quality management is focused directly on processes. The main components of a quality management system are leadership practices, adoption of a method, use of tools, measurement, staff development, and culture shift. Quality management is part of creating a work culture that supports continuous learning and improvement. In the performance management system, quality improvement and its focus on the nuts and bolts of work processes has a place along with community assessment and improvement planning, strategic planning, measuring and reporting strategic results, and the use of standards such as the public health accreditation standards and measures. Performance management is led by agency leadership, while quality management is led by staff. And both provide important feedback to everyone in the agency as well as stakeholders. Now let's look more closely at quality management. Why is it important to manage this system in a systematic way? Everything we do in public health, our policies, work processes, and infrastructure, links to the larger definition of the public health system. Even if we don't envision our work as a system, it is one. The second bullet is the focus of all quality improvement. Your work process determines performance. This is important to keep in mind. Success by design is more likely than success by chance. With a common aligned direction and integration among the parts, the whole is greater than the sum of its parts. When we get out of our own way, we can go further toward our goals. Quality management is based on a set of principles: understanding and meeting customer requirements, focus on process performance. This means understanding what your process is capable of and also understanding and controlling process variation. Using evidence to make decisions, and this means data, and application of a continuous scientific method like Plan, Do, Check, Act or other methods. Whether your quality management system uses Lean, Six Sigma, Plan, Do, Check, Study, Act, or another approach, to be most successful it must be grounded in management practices that promote these 4 principles. Let's take a quick look at each. When we focus on customer requirements, we actually ask our customers what they need from us, what they do with what we give them, and what the gaps are. Then we use that information to drive the improvements we make. We can't assume we understand the first time we talk. For example, when your customer says, "I need good service," you may assume they want it sooner. It is important to ask them what good service means to them. Perhaps they mean, "Listen to me and remember. Use words I understand. Let me know what to expect. Don't make me do something twice." Knowing clearly what the customer needs is vital to meeting that need. A second critical principle is to understand process performance. Quality management methods and tools are applied to processes. A process is a series of related tasks directed at accomplishing one particular outcome. Some examples of processes include the steps a barista takes to make a latte, the steps a manager takes to hire a new employee, or steps to documenting vaccination status during school registration. A system is a group of related processes. Examples of systems include selling me my daily latte, which includes the processes of taking my order, brewing my coffee, taking my money, and making change. A public health example would be our immunization system. Documenting vaccination status at school entry is just one process in the larger system. It's important to understand the differences between the two. A system is too big in scope to be practical for an improvement project. You wouldn't get far before feeling overwhelmed if you set out to improve our entire immunization system, for example. But what if you began improving the different processes that make up the immunization system? You'd get a lot further with that approach. A third key principle of quality management is using evidence-based decision-making, and that does mean data. An organization with a quality culture will measure both processes and outcomes, evaluate data on an ongoing basis, not just when or if problems are identified, and make decisions validated by data, not just logic or worse, gut instinct. The last key principle to discuss is the improvement method. There is no one best method. Many different models are used. All improvement methods are, at their core, the scientific method focused on business processes. Following a method helps you make steady progress, and following a method helps you identify root causes that get at the right fix. And finally, following a method increases the likelihood of sustainability, that the improvement can be maintained. Let's talk about the steps involved in putting together a quality management system. It's common for an organization to start with exploration. This is about leadership learning. Senior leaders look around for organizations they admire and study those quality management systems. They might identify a lead champion, designating and training an existing staff member, or perhaps creating a position to support the initial effort. Exploration leads to a pilot. Training will expand beyond the lead champion to encompass formal training of managers and key staff. Along with training will come some initial pilot projects. Ideally, these should be carefully chosen, perhaps focusing first on smaller projects that are still important to the agency, to boost staff confidence in applying the methods and tools, and to foster enthusiasm with good results. Eventually, the organization will develop a formal infrastructure, including establishment of a quality council or other formal quality leadership group. Early work of that group will be establishing a measurement system. As the quality culture expands, this measurement system will be improved and increasingly aligned with agency strategic priorities. Application of quality improvement tools will become more common across the agency in multiple programs. Eventually, quality management becomes a routine aspect of work. It becomes business as usual. In summary, creating a culture of quality takes time and will generally occur in phases. It's a journey. Leadership is at the top of this list of considerations because it is so essential. Culture won't change until leadership changes their own practices and sets expectations of staff as well. Identify what to measure, how to measure it, and how the information will be used. Measures should be aligned from the organization's strategic perspective down to program and individual work plans. Adopt a method and establish a common language and set of tools to go with it. And plan for staff development. Quality management is a field of study, continuously growing and adding new tools. Staff development can begin with a lead or champion of the efforts, but for the culture to shift, training and skills development must spread to more and more staff. This graphic is taken from the World Health Organization's Laboratory Quality Management System Training Toolkit. It shows how all aspects of the laboratory are involved in the laboratory's quality management system, from personnel to equipment to customer service to information management. Now let's briefly review our learning. Which of the following is not a key principle of quality management? Understand process performance, including capability and variation. Employ a continuous scientific method. Customer needs are of secondary importance. Use evidence to make decisions. If you selected C, you are correct. Customer needs are of primary importance in quality management. Good job. Here are some useful resources, as well as a list of other related topics covered in this series. We look forward to hearing from you if you would like further technical assistance on this or other performance management topics. This presentation is part of a Performance Management in Public Health training series, presented by Washington's Public Health Centers for Excellence and funded by a grant from the Centers for Disease Control and Prevention. The centers are located in the Spokane Regional Health District and the Tacoma-Pierce County Health Department. Our goals are to help local health jurisdictions and tribal agencies improve their results, prepare to meet public health standards, and achieve accreditation. In addition to this training series, we offer technical assistance and resources in performance management to improve public health outcomes. If you would like to talk with us about how we might assist your organization, contact information is on the preceding slide.